what I found is exercise is the most important for me personally. So that's going to a morning yoga class or running or biking or something that lifts the fog and lifts the weight of the morning. And my office staff makes fun of me. They know when I've exercised before I come to clinic based on my level of grumpiness.
And energy, I'm sure.
Yeah, right. I guess the opposite of grumpiness would be energy. So if the energy is higher and the grumpy meter is low, then I've exercised and I feel great.
Let's learn how our next guest gets up, dress up, and show up on purpose. Enjoy the episode. Hello, morning enthusiasts. Welcome to the Best Morning Routine Ever podcast. I am your host, Dr. Lunid, and today I am honored and privileged to have a very special guest to the show, Dr. Cameron Roth. Now, he is a fellowship-trained orthopedic surgeon, specializes in hand, wrist, and upper extremity care. His expertise in treating conditions range from fractures and arthritis to sports injuries and nerve disorders. Dr. Roth is committed to providing compassionate and personalized care to patients of all ages. So he sees a whole spectrum, and he even is on the board for the Chicago White Sox. And so I'm really excited to have him on here today. So with no further ado, Dr. Roth, welcome to the show.
Yeah, thank you so much for having me. This is a thrill, so I appreciate it.
Of course, it's my absolute pleasure. Go ahead and tell us about what got you interested in this space to begin with.
I think I'm probably sort of like your typical orthopedic surgeon who was an athlete growing up, but my father was a doctor, and he pushed me to work in the hospital in the operating room at a young age, and I, of course, said no as a 15-year-old. But then, as parents do, they sort of force you to do what they want, and I ended up transporting and being an operating room aide for 5 years or 5 summers, I guess, and opened my eyes to what it's like, the internal workings of the hospital and the medical profession, working with surgeons and techs and nurses and patients. And I just saw what a rewarding team atmosphere it was. And I saw how gratified my father's patients were. And I want to give back to the community what my father gave to people, and then subsequently moving forward what my mentors have given me. So that's how I landed here today.
Yeah, no, that's fascinating. Yes, parents will push you in the direction. You
Yeah.
follow suit though after a little kickback.
Yeah. And usually after a while, if you look back on it, you find out that your parents were probably right the whole time.
I know you don't want to admit it, but yeah, they know best, don't they?
Yeah, I'm comfortable admitting that now. It's taken a while, but I'm comfortable admitting that now.
We're adulting now, so we can admit that.
Yes, that's part of growing up and maturing, and yeah, I'm happy to admit that.
Yeah, and you're a father yourself. Do you see the same path?
No,
You
no, I'm not. No, I'm not a father. Future, hopefully, that
okay?
would be. That's the ultimate goal. My dad always said, if you have children, you get to live your life twice. So
Hmm.
that is my goal to find a partner and settle down and have children and be lucky enough to live my life vicariously through them and watch them grow up to be better versions of myself and my future partner.
Yeah, it is a truly an amazing experience. I'm new mom, and I get to experience it.
Congratulations. Yeah, very blessed. Very
Thank you.
blessed.
Thank you. For the patients that you work with now, you do work with patients with all different types of uh, issues that come with you, but different ages, right? Because you can imagine the elderly would have arthritis, and then you work with the younger version, and they're more like maybe injury from either working out or
Hmm.
sports injury. So tell us what the common conditions are that you see across these various age groups.
That's a great question. So I see patients of all age ranges from newborn to 100 or older, and injuries, sort of just fractures or broken bones in general, you see across all ages. And especially I work in Arizona, so there's a large population of older people who come down for the nice weather in the winter and are very active, play a lot of pickleball, golf, tennis, um, and they fall and break their bones. But as you said, as people age and you have wear and tear on your bones and joints, you get arthritis. We take care of that. I take care of a lot of younger athletes, so adolescents, high school, college, and then professionals. So a lot of shoulder and elbow injuries through throwing, a lot of gymnastics, through the wrist. And then, of course, your just common orthopedic injuries. So, nerve disorders, carpal tunnel, cubital tunnel. But it's a very active environment. So there's no shortage of people who want to get back to their previous level and high quality lifestyle.
Yeah. And for arthritis, what causes it? Because you imagine it's a wear and
It's a
tear
great question.
time. Yeah, right. Because my mom has arthritis and we don't know what to do.
No, it's a great question. So there's two general types of arthritis. So there's osteoarthritis, um, which we classify as more of the degenerative or just wear and tear. As you get older, the cartilage, which is the lining between your bones that makes them slippery and makes them glide, wears down. And the older you get, the more you see it in people's knees or hips or shoulders or ankles or wrists. And then there's the more autoimmune or rheumatoid arthritis and variations on that where you have somewhat of a malfunction in your immune system and your body at a very basic level just attacks your joints and can cause joint degeneration at a younger disease. So I mostly deal with osteoarthritis or autoimmune arthritis is dealt in a combination with me and rheumatologists and primary care doctors and other specialists.
Yeah.
And I see them if they need surgery. But what causes more osteoarthritis? There's likely a genetic factor, although I think that's above my pay grade and just my degrees. But a lot of it is aging and wear and tear. But there are sort of cellular and molecular level mechanisms that happen that I don't personally have expertise in, and I deal more on the surgical side of that. But it's incredibly common. We're all human, and you see it in all shapes and sizes of people.
Is it inevitable?
Great question. um, I would. I'm going to venture an educated guess and say no. I don't. I would say there's no quote cure, but I'll see. I'll say 50, 55-year-old patients I consider very young and vibrant to have X-ray evidence and physical exam evidence of arthritis, and I'll see people who are older in their 70s, 80s, even early 90s, where you'll take an X-ray of their shoulder or their wrist, and it will look pristine. And I don't know why that is, to be perfectly honest. Now, I would say, if I took an X-ray of the majority of an 80-year-old shoulder, I'm sure the majority of those shoulders would show arthritis, and that may be speaking to the quote inevitability of arthritis. But I think there are probably ways outside of my expertise to slow arthritis. I don't know about prevent or even reverse, because that would be the holy grail of orthopedics, but probably slow would be my guess.
Okay. That's good to know there are ways, and I want to dive into some of the ways that we can prevent. I'm sure nutrition is a big piece of it. Resting is a big piece of it, especially for athletes. But can cracking my knuckles lead to that? It's been
No,
not
I think that's an urban myth. I think
okay.
that's an urban myth. That's likely the air bubbles in your joint fluid. I know it makes a lot of people. There's certain people who can crack all their joints, and it relieves a sense of tension and stress and feels pretty good. But I really do think that's an urban myth, and I don't know of any high quality literature that speaks to that. So keep cracking your knuckles as much as you want.
Keep cracking away. My husband
Yeah, go
crack.
ahead, crack away.
My husband cracks his knees. I'm like, oh, is that right?
Yeah, no, it's okay.
Okay, it won't lead to arthritis. We debunk that.
No, I don't want to die on that hill, but I feel pretty confident that that is not the main cause of arthritis.
Okay.
Yeah,
Good to
yeah,
know. Let's
yeah.
talk about sports injury. And an athlete could be somebody who's doing CrossFit, who's running, who's doing marathons, who's even just like working 3, 4 times a week, right? So let's talk about those nitpicky, small little injuries that can happen and actually stop you from going to the gym for a couple of weeks. Like I had a hairline fracture on my shoulder that
Really?
you had to seriously be out for about a month and also.
Hmm.
So let's talk about these little things that the average person needs to be aware of so that they can continue their routine.
Well, it's most common for me to see in clinic someone I guess you would classify as a quote weekend warrior or so, 30s, 40s, 50s, very active after work, or is in some sort of run club or bike club or pickleball or pickup basketball. And they'll show up in your clinic and they'll say, I felt good for 45 years. And suddenly I woke up and now my shoulder's killing me and I can't do anything. So it's very common to have what I would probably classify as overuse syndromes or tendonitis, where you get inflammation of your tendon. It's very common for me to see inflammation of the rotator cuff tendons, which are the four muscles that surround your ball and socket joint of your shoulder and help move your arm up and out to the side and behind your back. As you get older, those things may pop up more and more, especially if you try to stay as active as possible. So I encourage people to play as many sports as they want, ski, play as much pickup basketball as they want, just being aware that once your shoulder hurts at 45, and that may go away for 5 years, it may pop up a couple more times in the future. But I just encourage people to stay active. People will always say, what I can't do? And I'll say, well, if it hurts, don't do it. And that's silly and half tongue-in-cheek, but also obvious.
Mm-hmm.
If lifting overhead or reaching for a plate or reaching for your luggage and the airplane really bothers you, well, stay down here for a while, and then eventually you'll feel better. But I don't want you to sit on the couch and watch Netflix all day. I want you to go and ride your bike or do the leg press at the gym or shoot hoops or just be outside and stay active.
Yeah, let's unpack that a little bit because I've heard that motion is lotion
I
for
agree with that.
joints. Okay, yeah, okay. Confirmed, stamped by Dr. Roth, okay?
Yeah, I agree with that because not only is staying moving just good for your physical health, your cardiovascular health, your bone density, your muscle mass. It's recommended for I don't want to say prevention of osteoporosis, but a delayed onset of osteoporosis, which is decreased bone mineral density, to do moderate exercise, light weight bearing activities. So that's light weights, walking, running, jogging, activities at the gym, swimming, because that can keep your bone mineral density or your bone mass or the quality of your bones higher. So, and then the muscles surrounding your bones will work and stay robust and strong. And then your cardiovascular health, which is arguably the most important, it helps you breathe and pumps the blood around your entire body, pumps the blood to your brain. That's really the key. So just keep moving, no matter what it is, whether it's a walk around the block or whether you're running a marathon every week.
Yeah, and
Doesn't matter.
Moving is actually going to help it feel better, especially for lower back pain. People complain of lower back pain. Usually it's not isolated in that area. It's usually maybe upper back. It could be a strain from somewhere else, a muscle
Mm-hmm.
imbalance from somewhere else that's causing the lower back pain. So moving and kind of breaking up some of the knots or the tension there can alleviate a lot of the pain. So it's shocking when people come and they say they're in pain. I say keep moving and they're like, but it hurts, but keep moving,
Yeah.
it'll get better.
I think the common misconception is I'm not a back or spine specialist, but we took care of a lot of patients like this in training. So the common misconception is I have back pain. I just need to lie in bed all day and take ibuprofen. And yeah, maybe you lie in bed for a day and you take ibuprofen, but you got to get up and move.
Right.
And you can work with a physical therapist, or you can just take a walk around the block, or you can get on the elliptical, or just something to move your body. Because eventually your body will work on starting to heal it. And if it's not nerve compression or a broken bone or something like that, then eventually over time, however slowly, it will slowly get better if you help contribute to it.
Yeah. Yeah, you alluded to this a little bit earlier with the skeletal muscle mass. I've heard some people say, okay, we're big boned in. And I had a CrossFit owner, gym owner come on and says, you can actually increase your skeleton muscle mass. If it's, I don't think I'm saying it right, but your skeletal mass.
Yeah, you can, exactly. You can increase so there's a few different types of muscle in our skeletal muscles, the muscles that we commonly think about when you're working out at the gym. There's also smooth muscle, which is in your intestines, and cardiac muscle, which is your heart, but the skeletal muscles are our biceps and our quads and our calves is what we think of. And that's working out. I mean, that's increasing the not only number of skeletal muscle cells, but increasing the size of the skeletal muscle cells. And that increases the amount of mitochondria in the cells, which are your energy powerhouses in the cell. So all of that, to a point, of course, you don't want to be, I guess, misproportioned, but will contribute to appropriate physical health.
Yeah, and then that can help with the inflammation, right? Combating inflammation in the joints later on in life.
Yeah, I think it just takes pressure off if you have, for example, strong quadricep thigh muscles and strong lower leg muscles in your calves. This can take the pressure off your knee joint.
Got it.
So the pounding that you take when you run is cushioned or I guess moderated by your muscles keeping those bones from slamming into each other.
Shock absorbers.
Yeah, of a sort. Yeah.
Yeah, that is fascinating. So people saying, I'm big boned. I've heard that before. It's essentially that can be with exercise. That could be changed. That that you can also increase that.
Yeah, everyone's different shapes and size. So everyone, coming from your parents who sort of is born differently, everyone has different shaped bones, but in order to hopefully live the healthiest lifestyle, you likely want to limit your body fat to a smaller percentage and increase your muscle mass to an appropriate percentage, just to allow your joints, your shoulder, elbow, wrist, ankle, knees, hips to move as efficiently and safely as possible, that eventually when you do find yourself on the black ice or you trip on a curb, that you have the ability to, if you stick your hand out or you stick your leg or foot out to catch yourself, that you have the ability to support yourself and that your body won't crumple and seriously injure yourself.
Yeah, and for people who are experiencing, say, wrist or hand injuries or even fractures, what percentage of that is surgery has to be surgically repaired, or can it just
Great.
be,
It's a great,
physical therapy or changing
that's a
up?
great question. So when you look at fractures or broken bones, there's relatively strict criteria on what needs to be, quote, fixed or repaired, or what needs surgery and what doesn't. And that's usually based on how far apart the bones are from each other, whether it's, quote, stable or unstable. So, whether the bones are stacked on top of each other, and if the body heals them, they won't move, versus if they're going to move at, the slightest gust of wind. So usually those need to be stabilized or put back and made straight. Orthopedics the concepts are relatively simple. I mean, it's a complex field, but the concepts are relatively simple. In terms of non-fracture related, so non-broken bones, so sprains, strains, tears, the vast majority of them can be treated, at least at first, with physical therapy or rest or exercises at home or strengthening or, every once in a while, a cortisone injection or something like that. And the vast majority of people get better without surgical care.
Okay, good to know. And let's talk about the parallels that you see between, or challenges between underserved communities and the work that you do in orthopedic care.
I think the two things that I probably see the most are access to care and then patient education. So I'll see all shapes and sizes in my clinic, and if you need care, then I'm happy to take care of you. And sometimes patients are unable to get, I guess, appropriate, well-rounded care. So a patient will come in with a whole host of problems, but may not have a primary care doctor or a general practitioner, or they, as a woman, they may not have an OBGYN, or they may have some chronic other diseases and not have an appropriate physician taking care of them. And as an orthopedic surgeon, my scope is relatively limited. I'm somewhat of a human mechanic, and it's hard for me to address the whole body issues, so the heart, the lungs, and that's not really my scope. And honestly, you wouldn't want me to do that. A lot of patients are unable to afford basic services, so giving them a removable Velcro wrist brace after a wrist sprain, or sending them to a couple sessions of physical therapy. I always tell patients, look, I'll take care of you in the parking lot. Like the finances don't matter to me, but you can't run a business like that.
Right.
Again, that's beyond my scope. And then, of course, a lot of patients also have a limited level of medical literacy or understanding. So hopefully taking the time to explain to them in basic terms what exactly is going on, providing handouts, providing websites, providing other resources, so that when they leave that 15-minute encounter, at least they have something in their hand that says, okay, I don't remember anything that the doctor said, but here's 3 pages that I can read on the bus ride home, or here's a website that they told me to look up on Google, or here's a list of home exercises that maybe I can do in my free time. So those access to care and I think patient education are probably the 2 most common things that I see.
Yeah, and I concur. It's all around. That's why it takes a holistic and approach to treating for any disorder. Anybody that walks through your door, you kind of need to partner with everyone. You kind of need to be
Oh yeah.
with every doctor that's involved with that, in that patient's life.
Yeah, and encouraging patients to not only seek out someone like me, but absolutely someone like you, and then of course a primary care doctor to as the conductor of the orchestra, to hopefully lead the patient to seeking appropriate expertise, physicians with expertise, in order to get them the most efficient and safest and well-rounded care.
Yeah. What's the most challenging piece for you as an orthopedic surgeon? Because I imagine some insurances they opt out to cover for some other, say, procedures that may be needed.
Yeah, I think I'm very lucky to have a job that I love and an organization that supports me, and I think our group takes the majority, if not all, insurances. So I don't think it's necessarily finances, maybe top 3. But I think the most challenging thing that I personally take care of is patient expectations. So you have a lot of high-level people who injure themselves and have had a very high quality of life pre-injury and want to resume that high quality of life as soon as possible. And some have realistic expectations and some do not. And I think my job is to set expectations appropriately, whether that's good news or bad news, and work with them along that journey. So if a patient gets back their full range of motion, full movement, full strength, no pain, then that's a win for all of us. And that's all I want for all my patients, but that's never going to be 100% of the patients. So just setting expectations, managing ups and downs
Mm-hmm.
of recovery, managing parents with children, managing friends and family of patients. That can be very challenging. And all we could do is just take more time to spend with people, give them transparency, give them access. I give patients my email address. I try to visit them in the therapy room. I mean, anything, any small thing you can do. It's not just me. I mean, my medical assistant, the therapist, the front desk. I work for a great organization. So I think all we're trying to do is build the patient up along this unfortunately inconvenient journey.
Yeah, adding the care and healthcare, right?
Yeah, that's important, and it gives back to you. We use the word rewarding a lot, but it truly, when a patient says, "Wow, that was a brutal 3 to 6 months of recovery, but I cannot believe that you and your group and your staff have been with me the whole way, and I'm so glad to be back to where I was before my injury. Thank you so much." I mean, I I don't know any other synonyms for rewarding at the moment, but it's gratifying. It's a great feeling to see someone walk out happy and
Yeah,
return to with a big smile on their face and say, "I can't believe I did it." So there's no better feeling in the world than that.
it's fulfilling.
Yeah, fulfilling is a great word too.
You found your purpose, and that drives you. That wakes you up in the morning. Yeah.
Yeah, and I'm sure it does the same. I'm sure it does the same for you.
Yeah, absolutely. Speaking of morning, Let's
Of
talk about
course.
your morning routine. How do you get up, dress up, and show up? Because I know you're on the road now, so that could change a little bit. So tell us about
Yeah. So, um, oh, not all of us are morning people, although a lot of, the majority of physicians have to get up quite early, especially in training when you wake up way before the sun comes up and you do a lot of work in the hospital way before anyone shows up and the sun comes up. And I spent a lot of my training um, not sleeping well. And that was the nights where I was allowed to sleep. So not sleeping well just because of generalized anxiety about what had transpired the day before and then what was to come the day after. And I realized a couple of things that I do and don't do anymore. So I used to wake up immediately in the morning and look at my phone for the string of text messages and emails warning me of what was to come as soon as I entered the hospital. So I don't look at my phone in the morning anymore. I try my best, unless I'm on call or something has happened, to at least take an hour before looking at my phone because there's such a deluge of information coming from your phone. It doesn't even have to be professionally related. It could be notifications to the news or fantasy football or the weather. And you don't need that information when your brain has just started processing the day. I've tried lots of methods of feeling better in the morning, walk outside, absorb 15 minutes of sunlight, drink a big glass of water. I mean, that's all fine. What I have found, and this is a long answer to your question, what I found is exercise is the most important for me personally. So that's going to a morning yoga class or running or biking or something that lifts the fog and lifts the weight of the morning. And my office staff makes fun of me. They know when I've exercised before I come to clinic based on my level of grumpiness.
and energy, I'm sure.
Yeah, yeah, right. I guess the opposite of grumpiness would be energy. So if the energy is higher and the grumpy meter is low, then I've exercised and I feel great. And sometimes that's not possible, but you try. And I would say that for me personally has been by far the biggest game changer is exercising in the morning.
Yeah, non-negotiable. It gives you energy for the day. It sets the tone for the day. It's almost like you've tackled one of the hardest parts. So whatever the day throws at you, it's a bonus. You got this.
Yeah, you feel it's just a feeling you can't describe after you finish a long run or a hard workout class and your body knows and your body gives those endorphins back to you and there's no better feeling in the world in my personal opinion.
Yeah, I agree. The happy feelings, the happy hormones follow you all throughout the day. You
Yeah, it's great.
you mentioned something that is worth noting is not picking up your phone for the first hour of the day. That is imperative. That's crucial because when once you open your phone, you check an email, then it's everyone's agenda for you, and it's no longer about your day. So let's talk about that out how that shift has revolutionized your morning.
Oh, it's if you and I have started doing this, if you critically sit and think about how you feel every morning and then think about how you feel before you look at your phone and then after you look at your phone or in general if you're on your phone for an extended amount of time, think about how you feel because yes, it is very sort of whether you're scrolling or checking things, that is an addicting feeling and your body wants to keep doing it. But I've noticed I don't feel well. I don't feel energized. I feel drained, like all of my soul is being sucked into my device. And I feel poorly. And then when you put it down, you have to sort of shake your head and get up and walk around. And I've noticed there's a general calm in the morning. And
Yeah.
then if you pick up your phone, even if there's nothing alarming on your phone, which usually there is, your mind starts to race. You say, oh my goodness, I forgot to X, Y, and Z. Oh my goodness, I'm late. Oh, I have to do this. I have this meeting. I have this surgery. Um, and then it just sets a harried, rushed, anxious tone to the day. So I have noticed, and I have thought a lot about this, that the less time I spend on my phone, especially in the morning, the better.
Yeah, I concur. I can't agree more. And you're speaking for all the entrepreneurs that's come on here is really just setting the phone down so that you can actually spend that time. With you, I heard a lot of intention setting, right? So, acknowledging how you feel and setting the intention early and say, like, I want to control the day and my thoughts right now, and I don't want to let anybody else or anything else come in to interfere with that. That's crucial.
Look, it just comes from trial and error. Being burned 1,000 times, you finally learn your lesson.
Yeah.
So after picking up my phone for 6 years straight in the morning and just feeling terrible, I learned this is not the way to live a life. Um, so it's
It's
just trial and error.
simple and it's not drastic. It's really just like, yeah, let's just set this down. You're not getting up at 4 a.m. and going for a run, working out for 2 hours. It's just a little minute shift. Now that's how habits are built. And so thank you for sharing that. Uh, Dr. Roth, tell us, how can we connect with you? Where can we find you?
So you can find me. I actually don't have any social media, and that's a conversation for a different time. I'd be happy to talk about
I
that at a
understand.
different time. If you count, actually, so I do have LinkedIn, but I don't think that counts as social media. But you can look me up on LinkedIn, and I think one of my charges is just transparency in general, to access to physicians or access to basic information that may help your recovery or healthcare process easier. So you can just look me up on LinkedIn. It's Cameron Roth, MD. LinkedIn. That's, you can just put that on Google. You'll see my picture. You can connect with me, message me. I'll give you my email address. I'll give you my phone number. I'm literally happy to talk to anybody just to provide them. I just want to give back what my dad and my mentors have given to me, and that's all I really care about. You can also look me up. I work for a fantastic orthopedic-only private group in Arizona, so it's called Ortho Arizona. So if you search for Ortho Arizona and just search my name, you'll go to my webpage if you want to just read a little bit more about me. But if you want to connect, just look me up on LinkedIn, and I'd be happy to connect with you, message me, and I'd be happy to talk more. And as many people want to connect, I'd love to talk to people. That's the whole point of this. Honestly, it's just to give back and reach other people.
I love that. It's your compassion comes through. You just want to give back what your mentors have given back and kind of pave the way for others in your way, or teach and help those
I
individuals.
hope so. I
Yeah,
hope so.
I can appreciate that. Uh, Before I let you go, tell me what's next for you. Yeah, I mean, you've been busy.
Oh yeah. So we're actually at the American Society for Surgery of the Hand meeting. It's our national national and international meeting of all hand and upper extremity surgeons. So it's really not only a time to learn and collaborate and talk to national and international leaders, but it's also a reunion of sorts. So meeting up with co-residents, co-fellows, mentors. I'm on a couple committees, so trying to make the meeting better every year, trying to create modules and podcasts and webinars for people throughout the year for more resources and information. In 30 minutes, we're going to moderate a session where there are the top papers of the year. We're going to have some of our, top residents, fellows, and faculty discuss them. It's really a jam-packed 3-4 days, and it's just a lot of fun to see so many accomplished, smart people in one building. And I'm so new in my career, and I've learned from so many amazing people that this is just an opportunity to really just walk side by side with some of the best and brightest minds and just learn from them and hopefully do my small 1% to contribute to the society.
Yes, yes, indeed. Yeah, enjoy that. Thank you for sharing with
Thank
us.
you.
It's been such an honor having you on here, Dr. Roth. Thank you, thank you, thank you.
No, I appreciate it. This has been a lot of fun. So thanks so much for having me.
Of course. Hope you enjoyed today's episode. Please comment and tell us what was your favorite part, your favorite habit that you are going to try out for yourself today. Comment below. If you haven't already, be sure to subscribe. Until next time, I will see you at the top of your best morning routine ever. Stay blessed.